This visual mnemonic presents the mechanism of action of anti-seizure drugs, a crucial aspect of neuropharmacology. Recall, in our previous video, we introduced and classified anti-seizure drugs. In this video, we'll picturize the mechanism of action of these drugs. Next, we'll discuss the pharmacology of specific agents and their clinical use. In this video, we'll discuss the pharmacology of ethosuximide. First, we'll talk about the pharmacology of the drug, then associate each key feature with this image to facilitate recollection. The cartoon character in this image is named Ethi. This should help you mentally associate the drug with this image. Starting with the chemistry of the drug, it is a 2-ethyl, 2-methylsuccinimide. The number-letter combination on Ethi's top is a clue to this compound name. Next, we'll discuss the pharmacokinetics of the drug. Absorption is complete after oral administration. Peak plasma counts is achieved within 3 to 7 hours. It is widely distributed in tissues, but do not penetrate fatty cells. Its volume of distribution is approximately 0.7 kilograms per liter and is not protein-bound. It is completely metabolized by hydroxylation in the liver and excreted in urine, and it has a half-life of 40 hours. Next, we'll discuss the mechanism of action of this drug. Recall from our mechanism video, ethosuximide was symbolized by the earthen potent socks in this image. The car on the bridge symbolized inhibition of calcium channels. One of the mechanisms by which this drug works, as shown in this image, is that it blocks low-threshold T-type Ca2+ current in thalamic neurons, which are the pacemaker current responsible for the rhythmic cortical discharges in absent seizures, pale young girl. It also inhibits sodium-potassium ATPase and depress cerebral metabolic rate, as well as inhibit GABA aminotransferase. The lightnings and the so-dim sky symbolizes sodium-potassium ATPase inhibition. If you recall from our previous videos, the chef's hat symbolizes metabolism. This, together with the fact that the hat is on the man's head, should help you remember that it acts by depressing cerebral metabolic rate. Also, notice that this scene takes place on a bridge to be consistent with the previous representation of the calcium channel inhibition illustration. At the end of the bridge, there's a mine with a light sign named GABA. This is to help you remember that ethosuximide also acts by inhibiting GABA aminotransferase. The wordplay used here is to facilitate understanding and recollection of this visual mnemonic. To discuss the clinical uses of this drug, we'll reference this image again. Clinical use. It is the drug of choice in the treatment of absent seizure. The pale young girl in this image is our recurring symbol for absent seizures. Other drugs that can be used in the treatment of absent seizure includes valproic acid, symbolized by the wine bottle, fensuximide, symbolized by a combination of the fern leaves and socks, and 2-drug snot, illustrated in this J-mage from the class oxazolidine-dione, dimethadione, and trimethadione. Finally, we'll discuss the adverse effects of this drug. The adverse effects of this drug include gastrointestinal tract discomfort such as nausea, vomiting, abdominal pain, anorexia. CNS effects such as lethargy, fatigue, headache, drowsiness, euphoria, and hiccup. Hematological abnormalities such as eosinophilia, leukopenia, thrombocytopenia, bone marrow depression. Hypersensitivity reactions such as exfoliative dermatitis, Stevens-Johnson syndrome. Thanks for watching. Don't forget to like and subscribe.